They sell it to the vet. The vet then dispenses that product and sells it to the pet owners, the equine owners, the swine farms, et cetera. We also sell directly to vets. So in our companion animal division, we actually have customer service, and our salespeople sell directly. So depending on the species, we have different channels that we sell to. On the OTC side, we sell our products, the OTC products, through our OTC distributors, who then either sell directly or sell through distributors. And then we also have this challenge in the industry. So if any of you have been to Pet Meds Express or any of the online retailers, you'll find Pfizer products there. However, we don't sell products to them. The idea is that we've always worked closely with the vet. So we choose to still work closely with them and not sell directly. However, our products find their way there. And the reason is because there are certain vets who were referred in the industry as diverters who will sell product. So this is a growing challenge, not necessarily directly for us, but for the vets. And the vets get very upset with us because they say, why are you selling this to these online companies? Why can't you control it? And the reality is that the market is changing. So I gave you the reference of the Little House on the Prairie. And it doesn't take a rocket scientist to say that things are changing. The internet is changing things, but for some people it's harder to accept. From our vantage point, we want to be prepared for the future, but we want to work in the present and ensure that as we move and as the market evolves, we still closely support our vets and provide value for them. And then we also sell to specific catalogs some of our OTC products. Again, we don't today directly sell on the internet, but one of my jobs is to, as the market is evolving, draft a strategy which has a phased approach. Depending on how the market evolves, depending on where our management wants to move, what are the options, what are the risks associated with those options, and how might we, as a company, position ourselves for that, both in terms of capabilities and also in terms of execution and how we actually build and execute upon those capabilities. Okay. So even though in our industry we have the pet owners, the farmers, our focus and direct customer is the vet. So those are the folks we work directly with. And from a digital strategy perspective, we do have a multi-pronged approach, which is both targeting the vet, but also we do have, depending on the products, there are certain types of products where we believe lend themselves more to DTC. So we are focused on the pet owners as well, but our initial focus is develop a strategy which is focused on the vet, and then on the pet owner side, we have multiple ways that we're trying to address that. We're working with partners. We're doing certain things ourselves. So over the course of the next 2-3 years, we plan on rolling out specific initiatives. In some cases, we want to test the market and engage. I'll show you an example of that and understand and learn. In others, we want to go full out and actually show our presence in a particular space. So I have 2 case studies, which may, again, they're not something, one of them we've actually launched this one, and the other one we plan on launching. And again, take these into context of what I shared with you. So there's no technological breakthrough here. However, it just will show you some of the learning. So we have a program for our horse owners called the Preventicare program. It's an assurance program, so not an insurance program, but an assurance program. So we actually focus on the wellness of the horse. We have products for any of you who may be associated with horseback riding or have dealt with horses. Deworming is an issue. So we have these the products for deworming. And the idea is if you, as a horse owner, are compliant with your animal's health, take them to the vet. We have a 3-way partnership. So anything that we do, we want to ensure that the vet is in the loop. And the partnership works like this. You enroll your horse in our program. And this program actually, we only early this year, we actually went online. This program has been running for several years using paper. And I'll share with you some of the experiences we had moving online. So basically what you do is we have 2 products, Strongyt C and now with Ford Dodge Quest Plus. You have to purchase those products from the vet. You have to have your annual visit, not your annual visit, your horse's annual visit with the vet. And you also have to do certain procedures. So vaccines, ensure the horse is on the proper vaccines, have dental care for the horse, because that is associated with colic. And if, for example, if you follow the right regimen and your horse still suffers from colic, which requires you to have an operation, Pfizer will pay for it, up to $5,000. So again, we're trying to back our product and also reward or actually mitigate risk against people who follow and are prescribed to a product, have the regimen, have the compliance. And in the whole model, the vet is an integral part because we drive traffic back to the vet, and we only support this program if you actually buy the product through the vet. You can today get this product from OTC as well, but our model is going through the vet. So we have currently in this program, again, it's a small space, about 28,000 horses, which are owned by about 15,000 horse owners. We have about 1,200 vets enrolled in the program. And so when we went online this year, our whole objective was to make it more streamlined, to make it more efficient. And we added one more thing. We actually added a small service fee for the horse owner. So it's $50 per year per horse. And from a coverage perspective, if you think $5,000 assurance doesn't seem to be that much of a large amount. But we experienced that, basic rule, if you offer something for free, then you charge it, people don't like it. So we had quite a bit of feedback. People have continued. Because it's annual enrollment, we won't know for sure. But we do now require that payment for re-enrollment, and many re-enrollments will be coming at the end of the year, beginning of next year. So we'll see how that program goes. The other challenge, or at least a lot of noise that we did hear, was certain vets where we felt this would actually streamline the paperwork. They complain, we don't want to go online. We've been, your client. And one of the things we did decide was that we were not going to have two programs, paper and online. It was only going to be online. We also, I think we had 2 people supporting the program, so our objective was that we will hopefully reduce that. That hasn't happened, so we still have about 2 people supporting it. So that was another learning for us, that just because we wanted something doesn't necessarily mean that customer service was reduced. But it has been a good experience. We do plan on relaunching parts of this program, especially in light now that with the Ford Dodge acquisition, Pfizer is the largest equine animal health supplier. In this animal health product supplier in this space. So again, it's been a good learning. We plan on expanding it, again, focus on the wellness. And this is the area where we do plan over the next few years offer many different programs based on a wellness platform for this and other species. Rimadyl. So Rimadyl is NSAID. It's for pain and inflammation. It's a 15-year-old product. It's been the #1 product in its category for a long time, although now we have generics. And it's actually very, from an effectiveness perspective, it's actually a very strong, powerful product. And pet owners who have used it, especially for larger dogs, love it. Dogs that aren't able to walk, can run around. And this, I was hoping, actually, my colleague Despina is sitting there. She's running this program. So I was hoping when we submitted our presentation to Maria that we'll have this launched. But as you know, sometimes things don't go as planned. So we haven't launched this particular pet Rimadog community, as we call it. And the focus is, again, very simple. We want the vet involved. So we want to drive traffic and drive compliance to the vet. So the way the program works is when you visit your vet, and if you are a candidate, or rather if your dog is a candidate for Rimadyl, they will give you a starter kit. So just like a sample, it's a starter kit. And the starter kit also has a coupon information for the pet owner to go online and actually get another coupon for the next visit.